How high conflict divorce can impact children, understanding the perspective of teachers. As in many countries, divorce is commonplace in Australia. A substantial proportion of divorces involve children under the age of 18, and for 5 to 25% of children, this comes with the added difficulty of exposure to high levels of parental conflict. Such conflict can include legal disputes and ongoing disagreements over living arrangements. Unfortunately, the negative impacts on the child's cognitive, emotional, social and psychological development can endure not only throughout their school years, but into adulthood. Dr. Stella Laletas, of the Faculty of Education at Monash University in Australia, sees that teachers and the school system are critical in identifying and supporting children at risk of not meeting their developmental and academic potential. Through their day-to-day work, teachers are uniquely placed to provide rich insights into each child's development and overall well-being, as well as their interactions with other children and their parents. Nonetheless, there is an important gap in the literature regarding teachers' experiences of working with children in high-conflict divorce contexts. Dr. Laletas sought to address this by exploring the experiences of 5 primary school teachers working with children exposed to high levels of parental conflict before, during, and after divorce or separation using semi-structured interviews. The responses from the teachers were analysed using a qualitative approach known as interpretative phenomenology analysis, which allows researchers to explore how individuals make sense of their experiences through personal stories. Dr. Laletas and her team uncovered valuable insights into some of the personal and professional challenges experienced by teachers, and also their professional concerns about the impact of high-conflict divorce on children. For example, the teachers discussed how differences in approaches to parenting between parents can lead to children being confused and lacking confidence in how they approach activities in the classroom and other behavioural and social difficulties. Dr. Laletas notes that for children who are ill-equipped to regulate and express their emotions and fears, the teachers reported the confident use of strategies to help children respond more appropriately. This is consistent with an overall increase in focus on social and emotional learning in school children, and an appreciation of the impact of this on academic outcomes and general well-being. But despite the heartfelt compassion and informed strategies offered by the teachers, they also reported feeling not being adequately trained to teach children experiencing these types of difficulties. The personally negative consequences of working with children in these situations included feeling distress, guilt, and at times even a sense of failure. The emotional intensity of caring for and caring about children can be immense. Dr. Laletas points out that this can place teachers at risk of burnout and make critical recommendations targeting different levels of the school system to better support teachers involved in the education of vulnerable children.